Okay, let us start the class about fat soluble vitamin K. Okay, vitamin K is required for the synthesis of prothrombin. Okay, it is the only fat soluble vitamin with a specific coenzyme function. Okay, it has a specific coenzyme function as we discussed earlier in the introduction of vitamins. Okay, it is required for the production of blood clotting factors essential for coagulation. Okay, in German coagulation. ఓకే ఇక్కడ కోయాగులేషన్ సి అని అనుకున్నాం కదండి మనం జర్మన్లో అయితే కే కేఓసి కేఓఏ GULATION. ఓకే hence the name K is for the vitamin K. Okay. Next, coming to the point, chemistry. Okay, vitamin K exists in different forms. Okay, vitamin K1 వచ్చేసినప్పటికి phylloquinone, which is present in plants. Vitamin K2 వచ్చేసినప్పటికి menaquinone, which is produced by intestinal bacteria and also found in animals. Okay, next, vitamin K3, it is a synthetic form. It's also known as menadione. Okay, next, coming to the point, all the three vitamins K1, K2, K3 are naphthoquinone vitamins. Okay, naphthoquinone derivatives. These three derivatives are stable to heat. Okay, these three derivatives are stable to heat, three vitamins. Their activity is however lost by oxidizing agents, irradiation, strong acids and alkalis. Okay, see, these are the structures of chemical structures of vitamin K1, K2, K3. See here, this is the phylloquinone structure and this is the menaquinone structure and menadione structure. Okay. Next, coming to the point, vitamin K is taken in the diet or synthesized by the intestinal bacteria. Okay, its absorption takes place along with fat, chylomicrons, and is dependent on bile salts. Okay, vitamin K is transported along with low density lipoproteins and is stored mainly in liver and to a lesser extent, okay, in other tissues. Next, coming to the point, dietary sources. Cabbage, cauliflower, tomatoes, alfalfa, spinach and other green vegetables are good sources. It is also present in egg yolk, meat, liver, cheese and dairy products. Okay. Next, coming to the point, biochemical functions of vitamin K. Okay, the functions of vitamin K are connected with blood clotting process. It brings about the post translation, that means after protein synthesis. Okay, protein biosynthesis in the cell. Okay, this post translation modification of certain blood clotting factors, it brings about the post translation modification of certain blood clotting factors. Okay, the clotting factors 2, prothrombin, 7, 9 and 10 are synthesized in active precursors are nothing but gymnosins in the liver. Okay. Next, coming to the point, vitamin K. Vitamin K acts as a coenzyme for the carboxylation of glutamic acid residues present in the proteins, and this reaction is catalyzed by a carboxylase microsomal. It involves the conversion of glutamate to gamma carboxyglutamate and requires vitamin K, oxygen and carbon dioxide. The formation of gamma carboxyglutamate is inhibited by disulfiram, an anticoagulant found in boiled sweet clover. Okay, warfarin is a synthetic analog that can be inhibit vitamin K action. Okay, warfarin is the synthetic analog that can be inhibit with vitamin K action. See here, this is the vitamin K dependent carboxylation of the precursors of clotting factors. Okay, see here, precursors of vitamin clotting factors 2, 7, 9, 10. Okay, it's synthesized as an inactive precursors in the liver. Okay, these precursors of clotting factors are synthesized as an inactive precursors of in the liver. Okay, vitamin K as a carboxylation of glutamic acid. Carboxylation జరిగి glutamic acid కింద రెసిడ్యూస్ కింద ఎక్కడ ప్రోటీన్లో, which are present in the proteins, and this reaction is catalyzed by carboxylase. Okay, అది ఎక్కడ మైక్రోజోమల్లో. ఓకే, it involves the conversion of glutamate to gamma carboxy glutamate. ఓకే, గ్లూటమేట్ నుంచి గామా కార్బాక్సీ గ్లూటమేట్ కింద కన్వర్ట్ అవుతుంది అనమాట. అండ్ రిక్వైర్స్ విటమిన్ కే, ఆక్సిజన్ అండ్ కార్బన్ డైఆక్సైడ్. The formation of gamma carboxy glutamate is inhibited by disumoral, okay, an anticoagulant found in the spoiled sweet clover. Okay, see here, this is the gamma glutamate. It is converted with the help of an enzyme carboxylase and forms this is the carboxy glutamate. It converts and with the help of carboxylase and vitamin K in the presence of it requires vitamin K to produce gamma carboxy glutamate, and oxygen and carbon dioxide also. It also requires oxygen and carbon dioxide. Okay, this is the glutamate, carboxylation of glutamate. That means conversion of glutamate with the help of an enzyme carboxylase. It produces gamma carboxy glutamate. It also requires vitamin K, oxygen and carbon dioxide. Okay, the formation of gamma carboxy glutamate is inhibited by disumoral and warfarin. Okay, disumoral అనేది ఏంటంటే an anticoagulant found in spoiled sweet clover, whereas warfarin is a synthetic analog that can inhibit the vitamin K action. Okay, next, coming to the point, deficiency disorders. The deficiency of vitamin K is uncommon since it is present in diet in sufficient quantity. Okay, it present in diet in sufficient quantity. Okay, and is adequately synthesized by the intestinal bacteria. Okay, it is adequately synthesized by the intestinal bacteria. However, vitamin K deficiency may occur due to its faulty absorption, that means lack of bile salts, loss of vitamin into fecus, that is diarrheal diseases, and administration of antibiotics, that is nothing but killing of intestinal flora. Okay, deficiency of vitamin K leads to lack of proactive prothrombin in the circulation. Okay, the result is that blood coagulation is adversely affected. The individual bleeds profusely even for minor injuries. Okay, even for minor injuries. The blood clotting time is increased. Here, blood clotting time is increased. It also causes hemophilia. Okay, it also causes hemophilia, hypervitaminosis K, and antagonists of K. Okay, in hypervitaminosis K, administration of large doses of vitamin K produces hemolytic anemia and jaundice, particularly in infants. Okay, the toxic effect is due to increased breakdown of RBC. And next, coming to the point, antagonists of vitamin K. The compounds, namely heparin hydroxycoumarin, act as an anticoagulant and are antagonists to vitamin K. Okay, the salicylates and disomeral are also antagonists to vitamin K. Disomeral is structurally related to vitamin K and acts as a competitive inhibitor in the synthesis of active prothrombin. Okay, this is the overview of vitamin K. Next, coming to let us discuss about vitamin C. Okay, vitamin C, it is a water soluble vitamin. Okay, it plays an important role in human health and disease. Okay, it plays an important role in human health and disease. Chemistry. Ascorbic acid is a hexose. Ascorbic acid structure ఇదిగోండి ఇక్కడ వేసాను, జూమ్ చేస్తాను. This is the structure of ascorbic acid. Okay, next, it's a hexose derivative. Okay, ascorbic acid అనేది hexose derivative and closely resembles monosaccharides in structures. Okay, it closely resembles monosaccharides in structures. Okay, and It is a strong reducing agent. L-ascorbic acid undergoes oxidation. Okay, here L-ascorbic acid undergoes oxidation. Excuse me. L-as oxidation. See here, L-ascorbic oxidation. Ascorbic acid undergoes oxidation to form dihydroascorbic acid, and this reaction is reversible. Both ascorbic acid and dihydroascorbic acid are biologically active. That means, however, D-ascorbic acid అనేది inactive గా ఉన్న, the plasma and tissue predominantly contains ascorbic acid in the reduced form. Okay, the ratio of ascorbic acid to dihydroascorbic acid in many tissues is 15:1. On hydration, dihydroascorbic acid is irreversibly converted to 2,3-diketoglutanic acid, diketoglutanic acid, which is inactive. Okay, diketoglutanic acid, which is active. Hydration reaction is almost spontaneous in alkaline or neutral solution. Okay, it is for this reason that oxidation of vitamin C is regarded as biological inactivation formation of the diketoglutanic acid. Oxidation of ascorbic acid is rapid in the presence of copper. Hence, vitamin C becomes inactive if the foods are prepared in copper vessels. Okay. విటమిన్ సి అనేది ఇన్యాక్టివ్గా ఉంటుంది ఇఫ్ ద ఫుడ్స్ ఆర్ ప్రిపేర్డ్ ఇన్ ద కాపర్ వెజల్స్. ఓకే, కాపర్ వెజల్స్లో ఈ ఫుడ్ అనేది ప్రిపేర్ చేస్తే ఇది ఇన్యాక్టివ్ ఫామ్లో ఉంటుంది. ఎక్స్క్యూజ్ మీ. Next, let us discuss about biochemical functions. Okay, most of the functions of vitamin C are related to its property to undergo reversible oxidation reactions. Okay, that is interconversion of ascorbic acid and dihydroascorbic acid. Okay, let us discuss about collagen formation, how the collagen is formed. In vitamin C plays the role of a coenzyme in hydroxylation of proline and lysine, while protocollagen is converted into collagen. Okay, here in vitamin C it's the water soluble vitamin, no, so here coenzyme function takes place. Okay, that's why here vitamin C plays the role of a coenzyme, the hydroxylation of proline and lysine, while protocollagen is converted to collagen. Okay, protocollagen is converted into collagen, that is post translation modification. The hydroxylation reaction is catalyzed by lysine hydroxylase for lysine and proline hydroxylase for proline. This reaction is dependent on vitamin C molecular oxygen and ketoglutarate. Okay, hydroxyproline and hydroxylysine are essential for collagen cross-linkage and the strength of the fiber. In this way, vitamin C is necessary for maintenance of normal connective tissue and wound healing process. Okay, next coming to the point, bone formation. Here bone formation, bone tissues possess an organic matrix, collagen and the inorganic calcium, phosphate, etc. Vitamin C is required for bone formation. Okay, next coming to the point, iron and hemoglobin metabolism. Ascorbic acid enhances iron absorption by keeping it in the ferrous form. Okay, here ascorbic acid increases iron absorption by keeping it in the ferrous form. Okay, this is due to the reducing property of vitamin C. It also helps in the formation of ferritin, that is nothing but storage form of iron, and mobilization of iron from ferritin. Okay, vitamin C is useful in the reconversion of methemoglobin to hemoglobin. Okay, it is also useful for the reconversion of methemoglobin to hemoglobin. Okay, next coming to the point, the degradation of hemoglobin to bile pigments requires ascorbic acid. Okay, for the degradation of hemoglobin to bile pigments, it requires vitamin C, nothing but ascorbic acid. Next, coming to the point with tryptophan metabolism. Vitamin C is essential for the hydroxylation of tryptophan to hydroxytryptophan in the synthesis of serotonin. Okay. Mm, Next, coming to the point tyrosine metabolism. Ascorbic acid is required for the oxidation of para-hydroxyphenylpyruvate to homogenesis. Okay, para-hydroxyphenylpyruvate, that is enzyme hydroxylase presence లో హోమోజెంటిసిక్ యాసిడ్ కింద కన్వర్ట్ అవుతుంది అనమాట. ఆక్సిడేషన్ అనేది జరుగుతుంది. ఎక్కడ అంటే టైరోసిన్ మెటబాలిజంలో. ఓకే, నెక్స్ట్ ఫోలిక్ యాసిడ్ మెటబాలిజంలోకి వచ్చేసినప్పటికి యాక్టివ్ ఫార్మ్ ఆఫ్ విటమిన్ ఫోలిక్ యాసిడ్ ఈస్ టెట్రాహైడ్రోఫోలేట్. ఓకే, యాక్టివ్ ఫార్మ్ ఆఫ్ విటమిన్ ఫోలిక్ యాసిడ్కి ఏంటంటే tetrahydrofolate అనమాట. Vitamin C is needed for the formation of tetrahydrofolate, that is enzyme folic acid reductase presence లో విటమిన్ సి అనేది is needed for the formation of tetrahydrofolate formation కి ఈ విటమిన్ సి అనేది కావాలి with the enzyme presence of folic acid reductase. Further, in an association with folic tetrahydrofolate, ascorbic acid is involved in the maturation of erythrocytes. Okay. Next, coming to the point, peptide hormone synthesis. Here, many peptide hormones contains carboxyl terminal amide, which is derived from terminal glycine. Hydroxylation of glycine is carried out by peptidyl glycine hydroxylase, which requires vitamin C. Okay. Here many peptide hormones contain carboxyl terminal amide, which is derived from terminal glycine. Okay. Here hydroxylation of glycine is carried out by peptidyl glycine hydroxylase, which requires vitamin C. Okay. Next, coming to the point, synthesis of corticosteroid hormones. Adrenal gland possesses high levels of ascorbic acid, particularly in periods of stress. Okay. It is believed that vitamin C is necessary for the hydroxylation reactions in the synthesis of corticosteroid hormones. Okay. It is believed that vitamin C is necessary for the hydroxylation reactions in the synthesis of corticosteroid hormones. Okay. Next, coming to the point, sparing action of other vitamins. Ascorbic acid is a strong antioxidant. It spares vitamin A, vitamin E, and some B complex vitamins from oxidation. Okay. Next, coming to point, immunological functions. In immunological functions, vitamin C enhances the synthesis of immunoglobulins and increases the phagocytic action of leukocytes. Okay. Next, preventive action on cataract. Vitamin C reduces the risk of cataract formation. Preventive action on chronic diseases. As an antioxidant, vitamin C reduces the risk of cancer, cataract, and coronary heart diseases. Okay, this is the overview of biochemical functions of vitamin C. Next, coming to the point, dietary sources of vitamin C. See here, citrus fruits, gooseberry, amla, guava, green vegetables like cabbage, spinach, tomatoes, potatoes, particularly for skin, are rich in ascorbic acid. Okay. High content of vitamin C is found in adrenal gland and gonads. Milk is a poor source of ascorbic acid. Okay. This is the dietary source of vitamin C. Next, coming to the point, deficiencies and disorders. Okay. The deficiency of ascorbic acid results in scurvy. This disease is characterized by spongy and sore gums, loose teeth, anemia, swollen joints, fragile blood vessels, decreased immunocompetence, delayed wound healing, sluggish hormonal function of adrenal cortex and gonads, hemorrhage, osteoporosis, etc. Most of these symptoms are related to impairment in the synthesis of collagen and or the antioxidant property of vitamin C. Okay. And this is the overview of vitamin C ascorbic acid. Okay. Thank you.